in the heart, nothing else. For that way, you first of all should show that you can auscultate the heart in typical points of auscultation, and you can classify signs that you can find here. I mean changes of the sounds, presence of additional phenomena like open snap in the apex, and the murmurs, are they or not, and where, nothing else. When you will sign conclusions about pneumonia, it's easy because they are only description of respiratory activity. Let me look at that, I will show you. Here, if you see finally at the end of your doings, you can come to the table and sign the questions that clear for you. For example, here, what type of breathing do you say? Vesicular, bronchial, and so on. What you can hear, you can sign the point of that is correct, nothing else. And one by one, it's only about respiration, not more. Finally, the diagnosis. Do you see? Is it equal clinical picture for bilateral pneumonia or bronchitis or what else? No, here we deal with pneumonia. That's why it seems to me you will hear everything about pneumonia. But if to speak about stenosis, there are much wider investigation of the patient that you must know theoretically. There are points that describe all clinical picture of stenosis. For example, color of the skin, shape of the heart and so on. You must know theoretical knowledge about stenosis, and in the conclusion you should sign all the questions that you know theoretically. But auscultation will be up to your doings in the diary. Auscultation you will find there. Their description of the picture according to localization of the valves with their properties. For example, mitral, aortic, and other valves. No, if you see that it's stenosis with changes and phenomena in the apex, in aorta, will you hear something? No, because the aortic will not present any symptomatic. That's why there it will be what? I don't know. The point that symptomatic absent, you will find that it's absent, nothing else. And when you find only mitral valve, there you will describe everything. Sound is increased, open snap present, diastolic pneumo present. It will be correct answer, nothing else. Do you see? About the paraclinical things, two. First, it's checking your BP, most easiest. Where you can show only technology, first of all. Conclusions, they're absent. It's one of the tasks when conclusion absent. And secretary will not give you the paper with conclusion because you should show only how to check BP. In both hands, twice, what to ask to the patient before. If you read today material, you know that you must ask, are you smoking, have you alcohol intake before investigation, so on. All of those things shows that you know how to work with the patient who had elevated level of BP, nothing else. And at the end, when you showed everything and checked BP, no need to sign anything in conclusion, will be absent. Conclusion will be only for ECG. In ECG, 3 tasks, if you remember, 2 arrhythmias and 1 MI. There you will do everything absolutely similar in all those situations because you will check ECG in any cases with the same technology. You are lucky because it's first time and you haven't experienced, and for us it's first time when we check with you the patients in those conditions. That's why we did for you easy variant for checking your ECG. Only classical lists, if you see, only those lists which are bilateral in extremities. Nothing else, chest lists no need to use. For that it will be much more short algorithm, easy for you. And after the end, you are obliged to come to the table, and if you measuring everything one by one, come till the final point when you can wash the hands and so on, and it will find ECG that equal to your task. It will be looking like you yourself recorded here. And according to your task, if you choose, for example, paroxysmal tachycardia, you're obliged to find what? Paroxysmal tachycardia, and show that you know how does it look, paroxysmal tachycardia. Then, in your conclusion, that will be in your hands, secretary will give you will find what? Paroxysmal tachycardia diagnosis, and sign that you are correctly recognized such arrhythmia. No, here, except that you see, according to CG, you can what? Present information about exacerbation and heart rate. Nothing else, it's very easy, because here you can count everything. But all such doing is within 8.5 minutes. But if you know by heart questions, how to ask, what to say, believe me, because we have experience of previous group, last 15th of January was first consultation. It was 3-5 minutes, not more. if you know by heart everything what to ask, like following, 3.5 minutes, not more, believe me. Now you have time for training. Some of you start to walk. Let's start since most simple thing, checking your BP. And my colleagues will help you to do one by one, because they will remind with you questions, what to do one by one, and answer instead your patient. What's the name and so on. Let's start.